I had a mother in tears ask me this question the other day. How do I know that the team of technicians, the behavior analyst that is eventually working with my son, how do I know that they're going to be trained and knowledgeable in ways that will best support him? And as I was feverishly scribbling down the words that I knew I needed to put into this assessment to make sure that the treatment team had a good direction, I was like, oh, this is a perfect thing that I need to share with not just this parent, but every parent. Because if your child is going to be in somebody else's care, if they're going to be receiving services from a team of people, how do you know that this team of people is well qualified and is giving your child the best possible treatment? And here are the keywords that I gave this mom. The first one is assent. Assent is a child's willingness to participate in treatment. Now, even if your child is non-speaking, there are a lot of ways that we can determine that a child is willing to participate in their session. And a team should have a very well thought out plan on what they're going to do to guarantee a child's assent throughout services. And what are they going to do with it when this child withdraws their assent? The second thing that I said is trauma-informed care. Your team needs to be knowledgeable in trauma-informed care. Now, this specific child fit the profile of pathological demand avoidance, PDA, and this video is not about that. It has nothing to do about that specific, but it's still a child who has pretty distinct aversion to following instructions and or being able to make choices even when it's something that they want to do. And we can address this through trauma-informed care practices. So your team needs to be knowledgeable on how to gradually build up some of these more complex things rather than shoving a child through an experience that's going to be emotionally heightened and charged for them. The third is play-based. Like what I said to this mom was, is your child having as much fun as he had when I was with him at the house? Is he laughing? Is he engaged? Is he happy that the person is there? Are they playing and it doesn't really look like a whole lot's going on? Then that's probably really good services. It's probably really good treatment. You want to make sure that they're actually targeting things. It can't just look like a person following your child around. Even if it's child-led, it needs to be adult-directed, meaning the adult is setting up opportunities for learning throughout the experience. And fourth, I wrote down the name Hanley. Now, Dr. Greg Hanley is a behavior analyst who has done a ton of work in our field about compassionate care. And he has a practice or an approach called skills-based training, SBT. And this has to do with how to teach children how to communicate what they need and want in a given moment and how to very gradually move to build up their tolerance to not getting that thing. So if you have a child who fits that PDA profile, your team should be pretty knowledgeable about Dr. Hanley's work and the SBT approach. And if you're interested in having me review your child's ABA program or walk you through the process of how to evaluate whether or not your child's services are the best possible services for them, DM me the word consult and we can set up a free 15-minute meeting to talk about it.